Good evening, CAM followers, and welcome to this evening's live with the lovely Dr. Jennifer Johnson. I'm very lucky to have her joining us today. Hannah was lucky enough to meet her at the IVAPM conference that she went to recently in Atlanta. And I was told to say that what happens on tour stays on tour, and no other details was given. So it sounds like they had a good time.
Yes, we did.
So this evening, our title is The Importance of Educating Pet Owners About Pain, which is very apt for CAM, especially as that is what we strive to do throughout our organisation. So I hope you will find this evening's live helpful. Before I let Dr. Johnson introduce herself, I'm just going to pop this video up here. This is my Dog in Pain course. It's a course that's been written by Hannah. It's an education course for owners, talking about pain and how to best manage it. It's great for vets to point their owners to if they've just diagnosed them with OA, or for an owner that's thinking, oh my God, I don't understand what's going on. This course basically goes through it step by step of what to expect and how to best manage it. It's free and it's on our website, also in our member zone. So head over and have a look. So over to you, Jennifer.
I was just looking at the graphics and I'm like, oh, that's a great course, because I think I have, so hi everybody, it's awesome to be here. I am Jen Johnson. I am a veterinarian celebrating my 30th year in practice this year. Hard to believe that I've been doing this that long, and longer because I think I was 14 years old when I got my first job at a clinic.
Wow.
One of those people who I thought I wanted to be a jockey, and then I hit 5 foot tall, and I thought I'm too tall, so maybe I'll go be a veterinarian.
Fair enough.
So I am a small animal veterinarian. I've been, for my whole life, I owned my own practice with 50 employees and 5 other associate doctors. And I retired from all that about 5 years ago and moved to the desert of Arizona. But I have special interest in pain management. The story of my career is that maybe I was out in practice for maybe 10 years, and I was realizing that I was doing a pretty good job, but if I couldn't figure out what was wrong with the pet that I saw, what was wrong with your dog, if I concentrated on relieving their pain, I had really much better success. So it was this aha moment in my career where I said, okay, I'm not so great at figuring out what might be wrong. So maybe if I just concentrate on relieving pain and comfort, that maybe I'll have enough time to figure out what's wrong. But I had much better outcomes with patients that I wasn't putting my pain focus first. And remember, this was 20 years ago, and we were just talking about pain management in veterinary medicine at that time. So it was a great time to see these pharmaceuticals become developed. So I've kind of seen it all happen in veterinary medicine over 30 years, and have found that my focus on pain management has been so valuable.
Definitely. Brilliant. So with your wealth of knowledge, we will start with this evening's topic. So I think we've all learnt from the resources from CAM, and also Holly's Army and things like that, that once a pet has been diagnosed with OA or another condition where there is underlying pain, that you can't just do it by giving pain relief. There is the multimodal input and things like that. But I think what owners really struggle with is knowing they don't know what to do. And that is where you come into play.
Yeah. I don't know if they don't know what to do, or for some reason they think um, that the physiology of their dog is different than what might be going on in their own bodies. I
Yeah,
don't know why the disconnect is there,
yeah,
because if we just sit back and think about it for a minute,
yeah,
we should realize that the condition may be different, but the way that you feel when you're uncomfortable is exactly how your pet is feeling. And they're probably feeling worse, because by the time you have any clue, it's much more involved.
mhm. Yeah, definitely. I mean, a lot of the time, if I'm in consult, I say to an owner, like, imagine when you've got a really bad back, how you feel. You just feel a bit sluggish. You're a bit more snappy than usual, and they're like, oh yeah, yeah, I am. Okay, that makes sense.
Yeah. Yeah, and I think that they know what to do, because they understand, if we can remind them of what they feel like, they understand why this is so difficult, why we miss pain so
Mm,
much in our pets, is
yeah,
because I always say, because the biggest thing that pet owners say, and I'm not going to be mad at all of you out there watching, but the biggest thing that I hear in the consult room is, how do you know Fluffy's in pain? He's not crying. He doesn't look like it. He does what he does. He eats and he
yeah,
drinks.
yeah,
And over the years, I probably am a little smart, and I say something like, well, how do you feel today? Did you get out of bed, and do you hurt? And they're like, oh yeah, yeah, I have a knee that needs replacing,
mhm,
and I
yeah,
I hobble along. And I
yeah,
said, well, did you tell anybody on your walk this morning? Did you walk up to the first person you saw, tap them on the shoulder, and say, my knee hurts, I
yeah.
am miserable today? And people are like, "No, I just go about my day." And I'm like,
Mm,
"Well, so does Fluffy. Fluffy
yeah,
goes about his day,
yeah,
and probably does it better than we do,
mm,
because they wanna please." I mean, animals, especially dogs, they were
mhm,
domesticated to please, so
yeah,
it's totally, um there, but we have to delve deeper in the signs. I really think that facial expression in animals is something that we didn't discount it. We just never really. I think veterinary professionals, veterinary nurses, and clinicians, we knew we could walk into our hospital, and we could look at all the animals, and we could say, this one needs pain meds, this one doesn't, because we, without even touching them. But translating that to the pet owner has taken a lot of time, and it isn't until very recently that we've been teaching pet owners that.
and when I think I've noticed it in practice more, when working alongside Hannah, is when we've taught them how to recognize and what signs of pain we can pick up on. They come in and they're like, "Oh, I think he's had a bit of a flare up because he's presenting in this way, this way, and this way." Um, and they're really on board and on it and able, and it's like, yes, you're amazing, gold star for you.
Yeah.
And but it does take a little while to understand, and I think as professionals we do need to think, actually they're not being stupid, they just need educating.
They just right. And some of the I always say I have four big truths
Hmm.
in pain management. So
Yeah,
for pet owners, the first truth is your pet is in pain.
yeah,
Totally in pain. Because if anybody tells me they're not, even the silliest thing, when your dog is running around and tears its toenail, it hurts. It's in
yeah,
pain. And relieving that pain is going to help them heal faster. So
mhm,
that's truth number 2. Humans, we know that too, that if we take our pain medicine when we have abdominal surgery, we are going to get up and start moving
yeah,
faster. And if we move faster, we're going to heal faster.
mhm,
I say we know this, but this is something that took a really long time to do. Some of you might be too young to know this, but for example, we used to have knee surgery back in the 80s, they put us in traction and we weren't supposed to move our knee after having a surgical repair. And this was in human medicine in the 80s. And it
That's
was
terrible.
it wasn't until really the late 90s that they started to think in human medicine, boy, we should probably not wrap you up from your hip to your toes after we repair your cruciate. So all these poor baby boomers now have really bad arthritic knees because that was done back then.
Yeah.
But anyway, um, the point is relieving pain is going to help them heal faster. That's number 2. And also either measuring pain, I call it measuring pain, but being able to be objective
Yeah.
about how things improve or don't improve when we throw treatments at you
Yeah.
is really important. And that isn't just for your veterinarian to assess. It's also for you as the pet owner to help, because really you will help us see what we don't see, because you probably know that when you bring your dog to my hospital, he's scared or anxious or really stoic and isn't going to show me the true extent of their comfort.
Yeah. Completely. Completely. So if you had an OA client that you've just diagnosed in your consult room with you, how would you go about explaining, one, what is pain? Like what do you mean he's in pain? He's not crying. And how do you go about explaining and getting them engaged?
Yeah, so I think that the best thing to do, because many times in the consult room, you'll bring your pet in. We were talking about this earlier. Bring your pet in for vaccines, and as we do our palpation, or we watch them move, or we feel their joints, we get this idea that this animal's in pain. Whether they turn around and look at us after we palpate their hip flexor, or as we're going along, they're massaging the muscles along their spine, they hunch,
Yeah.
or they have this scrunched up face. So we as the doctor with so much experience, we're like, this dog's in pain, and we're already deciding where we think it may be and what the diagnosis is. But the first thing that I would say to a pet owner is, I think your dog's in pain. I think it has osteoarthritis in the hips or in the knees or in the spine. And they'll say what you just said. No, he's doing fine. And then there's a lot of check sheets, and I know that CAM has them on their website. IVAPM, the organization that I'm involved in, the International Veterinary Academy of Pain Management, we have a checklist for dogs and cats, and the checklist is really simple. Has he had slower getting up and down? Any behavioral changes? The one I have a pit bull who's 9 years old, and he now poops when he's walking.
Yeah.
So he doesn't crunch his back the way he used to.
Yeah.
And so I know that my pain management routine is not good enough for him now, and I
Yeah.
need to ramp it up. But that was one of the first things that I noticed. He would kind of, and not one nice big poop
Nice.
like
Yeah.
he used to.
Like use 8 poo bags instead of 1.
Right, right, because he has trouble getting into that position. And usually, pet owners are surprised at the idea that these could all be symptoms of pain.
Yeah.
And the other thing is, because dogs can't tap us in the shoulder and say, "Hey, today particularly really hurts."
Yeah.
I really encourage people to be able to be scientists in their own house and follow through with my recommendation to do some type of what I call a pain trial.
Yeah.
We have to be scientists. You have to help me, and you have to give this medicine the way I'm telling you to for 10 days and don't stop no matter what, and keep a diary and say, how was the pooping today? How
Yeah,
did he jump down from the bed today? Could he get out of the back of the Range Rover, and that kind of
yeah,
thing.
yeah. No, definitely. This is a really good point from Ruth. So a lot of this missing pain in our pets is education. Growing up in the 80s, our old dogs were just getting old and slow. And that's what I thought when I got my own dogs. It's not until someone tells you and you see behaviour changes and then subsequently see improvements after meds, etc., do you realise. Telling other dog owners about it is an absolute uphill battle. As a dog walker, so many people don't want to hear it and definitely don't want to believe it.
Oh, Ruth, that's so good because
Yeah.
I have I have an 85-year-old mother, and she's feisty, but um I often think about extrapolating her 85-year-old life to a senior dog of the same type of age, and I would never say to her, well, you're just getting old and slow. We know, like, she can pinpoint it and say, yeah, I'm having a rough day today because I have hip pain and I have hip arthritis and it's been really bothering me today. And plus, her fingers, she loves to garden. And she's like, I spent too much time getting up and down and I was using my fingers.
Yeah.
And so I agree. I don't know why in the 80s we just kind of thought, well, we also thought that newborn babies didn't need pain medication when they had should we should talk about circumcision, like, but we didn't do these things.
Yeah.
Like, newborns don't feel pain. Let's do heart surgery on a newborn baby without anesthesia and pain management because their nerves aren't fully developed and they don't feel pain.
Yeah.
Or, so it's not it was what we were taught, but it isn't true. It's never been true, even in the 80s.
Yeah. And the amount of people that you do still hear a lot of people say, oh, they're just getting old and slow, it's part of getting old, or the amount of people that will ring up the vets and say, oh, my dog's gone off its back legs. And again, it's
Well, and I always say, this is another thing that I'm really aggressive about because in humans, if we're getting old and slow, and then eventually we're losing our back legs, our legs, we only have two, we move to a walker, and then we move to a wheelchair, and we end up, because of disuse, not being able to go the other way. In dogs, I think it's really dangerous to wait till that moment because they lose their wheels, they lose their life faster, so we want to prevent that. We want to prevent that muscle weakening that happens in humans because we do the same things to ourselves. I mean,
yeah,
we're more aware that it's arthritic pain, it's in humans, but we still don't treat it aggressively enough. People don't do enough um, low impact exercise, muscle strengthening. They may take the non-steroidal anti-inflammatories like we do with animals, but they are not doing what they should do. And then they basically resign themselves to, I need a walker and I need a wheelchair. And in animals, it's the same progression if we do nothing, but then we have the sad fact that we're euthanizing for something that we could have treated.
yeah. And I think with the people that are like, oh, I don't want to hear it, it's almost guilt because they think, oh, I could have done something, but it's too late now, or they feel bad that they feel like they've left their dog in pain.
Well, I agree with that. I think that that's a tough decision and discussion for pet owners because that's why you had said, when should we educate? I think it's like puppyhood. Like, really, because I think that the sooner we do that, because if we could teach people, and there's a lot of research, if we could teach people with osteoarthritis, when you get a large breed puppy and you think that they're invincible, there are so many things that you can do during
Yeah.
that growth phase to reduce the possibility that they're going to have hip dysplasia and osteoarthritis.
Mhm.
And just like us, maybe we shouldn't be doing high impact, crazy exercise it at only on the weekends with
Yeah.
our dogs
Yeah.
because we work all day. Maybe
Mhm.
we should think about it when they're young
Yeah.
and start to condition them in the right way.
Yeah.
I know I messed up my childhood dog because I was in school all day, and on the weekends we would do crazy, frisbee high
Yeah.
in the
Yeah.
air and the whole thing. And the dog, she wasn't a purebred, but she was kind of a border collie type dog. She lost her wrists. She had that breakdown and hyperextension of her wrists and really bad front leg osteoarthritis by 10. And
Yeah.
if I hadn't have done that with her, if I had thought about it when she
Yeah.
was young, I could have prevented that.
Yeah. Definitely. I think it's when you look back, you're like, oh God. Oh.
Yeah.
I
Right,
could
exactly.
have done
And the same thing with us. I mean, humans, we're finally realizing that there's low impact exercise is so good. It's
that.
so good for weight management. It's so good for we want to have some cardio, but we want to have muscle strengthening. So
Mhm.
the combination of both and trying to start this exercise regimen with pet owners really early is so important.
Yeah. Cam's got it's quite a new resource. It's a puppy guideline download, which is basically a booklet on puppies and how to bring them up in a way that doesn't, well, help prevent, but helps to reduce like high impact exercise and things like that. So if you work with puppies or you've got a dog walking business, it's an idea to hand those out. Um, I
That's
think
a great idea.
the thing with, yes, you might have 10 people that don't want to listen to you, but one person might actually listen. And if you can help one person, that's brilliant.
Yeah, absolutely. I agree. I think that's a wonderful resource. And I think the idea that people are using dog walkers, yay for your business,
Yeah.
is really valuable because people are realizing that sustained exercise for a dog is so much more important than just going out on a Sunday and doing some crazy stuff,
Yeah.
just like with
We've
us.
actually attached it into the streams so everyone can go straight to it. It's the Cam Puppy Guidance Caregiver handout. So thank
Yay.
you. I've got a really good client who actually, her dog got diagnosed with osteoarthritis in its elbows, and it's because she used a ball thrower all its life. On the beach, would go down, chuck the ball, chuck the ball, chuck the ball. And
Ah,
since he's been diagnosed, she's now made little business cards saying "Do not use a ball thrower" and hands them out to people that are chucking balls on the beach. I'm like, yes. So it's
yeah,
education.
I used to show a video, I think it's on YouTube, it's crazy dog fails or something,
Yeah.
but, it where they're just dogs are just doing dumb stuff because people are like, "My dog doesn't do anything to make him have arthritis, like, how does that happen?" And it's like and there's one for cats. For years, people with cats, it's so funny, they're like, "My cat isn't in pain. It's just dumb." You know how cats like just fall off the bed? Well, no, they're not stretching their legs and then you have the dog that's running across the sand and tumbling and doing crazy stuff and yeah, if
That's
I
really
did
good.
if I did all that crazy stuff,
Yeah,
I wouldn't be able to walk.
completely. Completely.
Yeah.
I'm exactly the same.
Yeah.
So when you earlier on you spoke about like objective monitoring and things like that, and you said that IVAPM has a very good resources on there, which we can add to the stream afterwards for people. So IVAPM can works quite closely with them. They're a great organisation based over in the States, and it's a great resource for students, especially because they offer free membership, don't they, to
Yes.
students? So
Yes, and it is based in the States, started in the States about 20 years ago, but it is in an international community to try to educate veterinarians. And there is a program where veterinarians and veterinary nurses can become pain management certified. So if you go on the website, there's actually a list of everybody that's a certified veterinary pain practitioner in the world, and you can look at it by country and um, find somebody near you that has CVPP certification for pain management, which means that they've had specialized training in things like rehabilitation or acupuncture or photobiomodulation, laser therapy, um, all kinds of techniques, acute pain, and other pharmacologics, joint injections, and things that can be really helpful for pain management.
yeah, definitely. So also head over to that amazing website because there's lots of good things on there. Obviously, when owners are educated, they are able to identify pain earlier. Have you got any ideas of how you can educate clients, like if they're just sat in the waiting room, if they're out walking their dog, things like that? How would you go about that?
Yeah, so I generally try to be really objective because there's so much bias in what people think works and what doesn't. I mean, we try to be pretty scientific. For one thing, if I tell you to come and do treadmill work and massage and some rehabilitation with me, you're making this big commitment to come to my practice, and you really want it to work because or
Yeah,
maybe you don't want it to work because then you don't have to come anymore. Like there's a bias always because you're like, oh, this is too much trouble to pack the dog up in the back of the car and go over there. So I always try to be as scientific and objective without promoting my biases onto pet owners. So I like the Canine Brief Pain Inventory,
yeah,
CVPI.
yeah.
I still think that's the easiest one for clients to fill
Mhm,
out.
mhm.
And I ask them to do it in the waiting room. I just give it to them
Yeah,
without any kind of push or bias or asking them the questions because I don't want to lead them on. I just want them to fill it out, and I don't even want them to remember what they said last time. I want
yeah,
it to be, because then we can really get an idea. And it is validated for chronic pain in dogs and for cancer pain, so osteoarthritis and cancer pain. So it's a really good tool to be able to um, and as clients are filling out and circling, it's really easy. They don't have to
mhm,
write anything, just circle.
yeah,
They that also triggers them to say, "Oh," and
mm,
sometimes everything's great, but in my practice, we asked everybody to do it.
yeah, yeah. No,
And
that's
that was, and so sometimes they were like, "Well, I'm here for an ear infection." And I'm like, "But just fill this out."
yeah,
Like,
yeah. Just in case.
just chew it. Because it also was helpful to have them do it before the examination, because sometimes we create bias because as we're doing an exam, we are noting things or speaking out loud or talking about. So then they already have this. So I try really hard to, especially with follow up when we're doing treatments too,
Mhm.
try very hard to just have them fill it out first before
Yeah,
they get all this other
brain fog and everything that's going
right,
on.
right, right.
No,
And there, I know where it's canine arthritis management, but I love my little kitties, and there's a wonderful website for cats.
yeah,
The and they have the feline musculoskeletal pain index.
Yeah. Mhm.
And
Mhm.
I think that anybody with cats, we're just getting started with really
Yeah.
helping people with their dogs. And cats, these poor cats are suffering
Yeah.
terribly because
Yeah.
we're completely ignoring them.
Yeah. No, completely. We had a whole month in March which was dedicated to cats, and
Yes.
it was just like scary,
Yeah.
scary what you actually miss.
Yeah.
They're
And
so
their symptoms are a little different sometimes, with cats. They'll the attention seeking or the hiding or the grooming less or things like that that you don't always think about. The behavioral issues with elimination, so all of those things. Dogs that have osteoarthritis, you may have changes in postural,
Mhm.
um, when they're eliminating, but you don't usually have the accidents in the house like you do with
No,
cats who just, are uncomfortable. So it's interesting. It really is.
definitely, definitely.
Yeah.
Hopefully, they'll get a bit more research on the good old cats.
Yeah. Yeah. Exactly. Exactly. Well, speaking of oh, go ahead.
No, you go,
Go ahead.
you go.
Speaking of research, I mean, that's the other thing that I know that you had a really good live with Dr. Duncan LaSalle and talking about how the research is really showing that we're missing osteoarthritis in dogs
Yeah.
for years.
Yeah.
So think about if nobody diagnosed you or did something for your arthritic hip until it was end stage and you had to
Yeah.
have it replaced. Like that's
Yeah.
way too late.
Yeah. Way too late. It's scary, really
Yeah.
scary.
Mhm. Yeah.
We've had a really nice comment from Tracy saying, I've realised how good yoga was for me. So I've started teaching owners with puppies to do stretches with their pups in a slow proprioception way to have good muscle building and then telling them to keep it up into old age to keep muscle tone strong.
I think that's so wonderful. I wish somebody would write a book. Don't tell Hannah, she'll
No.
ask. Somebody would write a book for puppy trick training
Yeah.
that is more exercises, stretching, things
Yeah.
like that. We've been doing it with our horses for a lot longer. Well, not everybody, but
Yeah.
many people are much more aware with our horses because we're on their backs and riding them than
Mhm.
we are with dogs. But that same kind of stretching exercises. So with our horses, I don't know if anybody in the audience has horses as well as dogs, but we, from a very young age, we would make sure that our horse would extend and lateral bend their neck for a treat. So you put the treat back by where the saddle is on the, and then have them stretch for it, and then the other side, and then between the legs. And why don't we think about doing this for dogs? Like
Yeah.
instead of making them jump really high to
Yeah.
catch a ball, how about we do yoga? We like make
Yeah.
them bend, make them
Mhm.
sit, make them stand.
Yeah.
In fact, sit to stand exercises, having them sit square and then stand and then sit square and then stand or
Yeah.
up on their back legs, that's all really good
Mhm.
balance,
Yeah.
for
Yeah.
dogs. I think that if I could teach all pet owners to do that and really be aware of how a dog sits squarely, without flopping on one hip
Yeah.
or another, and really training them to do that, that's really helpful. That the Especially with dogs that have high risk of cruciate disease, we know that chronic cruciate ligament disease, so the ligament in the knee, we know that if we protect that knee, there's a genetic component to this and it's chronic. It's not really the athlete, it's not the footballer who's running and twisting and turning.
Yeah.
It's it's a chronic disease process. We
Yeah.
know that there's a genetic component. There are breeds that are overrepresented. So if we know that at puppyhood or young adulthood of these dogs, and we're teaching them, consciously teaching them, this is what they do with female soccer players in the US. They have
Okay.
ACL prevention where we're strengthening the quadriceps muscles.
Yeah.
So in dogs, the first thing I think of is sit to stand, and I think of proprioceptive work where instead of taking your dog on a straight line walk, how about going up and down the curb, or making figure eights, or things to teach them where their feet are, especially their back end. If you watch a dog walk, they're usually pulling with the front and the back ends kind of just,
Yeah.
so maybe we should do hills. Maybe we should not take them down steps, but take them up steps and then down a hill, or just on and off a curb, or make your neighbors think you're crazy, walk them in a figure eight, so that they're learning how to place their legs properly and also use their back end appropriately.
Yeah, definitely. Definitely. I think this is a really good one from Annie. So gradually reducing my dog's pain meds. He is a 5-month post-op following spinal surgery. 2 days after reducing the dose, he became really quiet and disinterested. I reinstated the meds, and within 24 hours, he was back to his naughty self. Really good to see.
Yeah, so that's not a bad thing to do. Of course, just like us, we talk about this a lot because in humans we use non-steroidal anti-inflammatories. We use our anti-inflammatory pain medication at an as-needed basis all the time, and were taught in chronic pain or post-surgical pain in animals that it's difficult to do that because we don't know, we're chasing pain. But once they're on it and things are going really well, to try to adjust to the lowest dose necessary is a great thing. That's
Yeah.
what we try to do for ourselves. I mean,
Mhm.
least amount of pain medicine needed, and being really in tune to noticing that something like they're not as spunky, they're kind of hiding, they're not up and out, they're
Yeah.
not ready, they're not ready.
Yeah. Yeah. That's really good that you're able to identify that, because that's something that someone may not have thought about. So it's good
Right.
education to understand that. Sorry, I completely went blank for a minute. So education in your practice, you give time. How long would you spend time with your owner? I think a lot of people struggle obviously with time, and you get them to do the objective monitoring at home. Is there anything else that you would point people in the direction to?
Yeah, so, you mean time in the exam room? That's
Yeah.
why I have Evie, because I think that, veterinary medicine is undergoing a change from 30 years ago anyway. We're much more in tune as pet owners to be proactive,
Mm.
and I think this is really valuable. I think that many times, in the past we were reactive. Something's wrong, let's go. Now, I think the trend towards pet ownership is our pets are truly part of our family. They are our children. We treat them the same way. And many people come to me and say, I'm here for my wellness, my proactive, give me everything. And we really have changed our philosophy in my practice where we want to evaluate everything we can, and people expect it. So
Yeah,
we do spend a lot more time than we do for
yeah,
the reactive medicine.
yeah, yeah, yeah,
And it prevents people from being reactive as well because they learn so much. So our office time is our appointment times are longer, and I think people really appreciate
yeah.
having that knowledge
Hmm. Yeah,
before
definitely.
something happens.
Yeah, definitely. And also, as it is Vet Nurse Awareness Month, we'll big up the vet nurses and say that they are there to also provide information on lifestyle, provide exercise plans, and they work closely with the vet to provide a whole package to try and help you guys.
Yeah.
So definitely. There was one question that Hannah was desperate for me to ask you, and that is, what would you like to see change in pain management over the next couple of years?
Well, of course, every veterinarian, I think every pet owner too, would love access to new treatments, new
Mhm.
effective treatments,
Yeah.
and that's happening, that's coming. From another perspective, though, the treatments are out there. I would like clinicians, I would like veterinarians to not be so reluctant to try multimodal pain management. And I think with humans, that is also true. One particular drug by itself or one particular non pharmacologic thing by itself
Mhm.
usually isn't going to help, especially in chronic pain of osteoarthritis. You know, I think that making sure that people understand that we're not trying to drug your pet. I would like to see more pet owners have a collaboration with the type of non-pharma things that they try on their own. That
Mhm.
you're always going to be inundated with this new great idea or this new great herbal supplement,
Yeah.
but it would be nice to be able um, to guide pet owners in what would be better, what would work better. And of course, I think the biggest thing with pain management is that I would love to see change is that pet owners are much more in tune. And I think this is going to happen because of the opioid crisis in the human side. People are much more aware of what we're doing in animals. We've never really used opioids for pain. We can't.
Mhm.
It doesn't work
Yeah.
for chronic pain at all. And we've known this. But plus, it's not well metabolized. Oral opioids are not well metabolized. You will still see us use opioids for acute pain, just like they should be used
Yeah.
in human medicine. And maybe this is why pet owners for so long are very skeptical when we say your dog needs to be on pain medicine. Right away, they think we're going to put them on morphine or something,
Yeah. Yeah.
because they hear pain medicine and they don't think that aspirin is a pain medicine or that,
No.
eh, eh,
Yeah. Yeah.
I'm not
It's they get scared that you're suddenly shoving meds at their dog,
right,
or
right,
thinking, oh God, well, how much is this going to cost me?
right.
A lot of yeah.
Right. And I think that that's probably the thing. And it's education like this, like CAM and that and IVAPM that really we're not we're trying to help everybody. Here's our goal in life. Our goal in life is that we want our dogs to live longer, and we
Mm.
don't want them just to live longer. We want them to live better.
Yeah.
It's great to be 100 years old, but if I'm 100 years old and I'm in a wheelchair, this isn't good. But
Yeah.
so we want our dogs to live longer and live better because we already are upset that they don't live long enough. So um
Yeah.
so I think that for sure we can work together for this, and it's not shoving medicines that you can't afford down your pet's throat. It's remembering the concept of pain management, that they're in pain, and if they're not in pain, they're going to live longer. They're going to feel better, and
Yeah.
so are you.
Yeah. Definitely. So, top tips for people to take home today. What
Top
do you
tips.
top
Your
tip?
pets well, your pet's in pain for
Yeah.
sure. Be aware of signs and be aware that what try to be very objective with what you're using, because there's probably a lot of you out here that are doing things that you haven't run by your veterinarian. You found something online or some supplement, or you're doing this or you're doing that, and but try to be scientific about it. Get your hands on a checklist and try to say, okay, every Sunday I'm going to do this checklist and I'm going to see this week was better than last week, or, that kind of thing.
Mhm.
And I think that's really helpful. Also, if you have a young dog and you're doing some sport with that dog, or even if you're not, you have a young couch potato, don't don't ignore what we're talking about, canine arthritis management. Or somebody, you have an old dog and you have a young dog, you're concentrating on your old dog, and that's why you're in this group. If
Yeah.
you have a young dog, start to think about this. I mean, we all sit here and we say, gosh, when I was 19 years old, I shouldn't have done this. I
Yeah.
really ruined, but start to think about long-term preventive care, because osteoarthritis, there's genetic component for sure, there's work component, but a lot of things can be prevented or slowed or
Mhm.
reversed before
Yeah,
it becomes problematic.
definitely. And identifying the pain earlier on will then prevent it from winding up into this massive problem. So if
Yeah,
you're able to identify it when they're 3 and they haven't developed behaviour problems or compensatory changes and things like that, brilliant. But if
right.
they come in when they're 13 and you're dealing with an aggressive dog that's got highly muscled at the front, no muscle at the back, that's gone off its legs,
Yeah.
it's
Ye
hard.
y Yeah, and I think that's hard for people to realize, that the reason that we wanna be very, very aggressive, and again, humans as well,
Mhm,
if we're not aggressive when we have acute pain, there's no way for us to tell if we're going to have problems with chronic pain down the road.
mhm.
So if I cut your hand off today, sorry, and create this horrible acute pain situation, and I do not um, control your pain adequately at the time of me cutting your hand off,
Yeah.
you could heal. Your body has a remarkable ability to heal. This is great news. But there's a there's a percentage of situations where you may have chronic pain your whole life because
Mhm.
I didn't adequately control it, and your body can't deal with that.
No.
And so I always tell people to assume that every situation that your pet is in, even if they are just going in for castration,
Mhm.
every situation that they are in has the potential, if they don't get adequate pain control for that painful situation as an acute time, has a potential to create a lifetime of chronic pain.
Mhm.
And that's a scary thought,
Yeah.
but it's very important to think of, if your dog has horrible anatomical bad hips
Mhm.
at a very young age,
Yeah.
and we know that
Mhm.
that's going to become a chronic pain situation because
Mhm.
you have the ball and socket moving and
Yeah.
moving and moving.
Mhm.
Even if there aren't any arthritic changes, even if the dog is great and running around, this will be a chronic pain phenomenon. This dog may have issues with behavior, aggression, all of these things.
Yeah. I've got a 3-year-old who's got really bad knees and just bad back legs, full stop. And she already has started like compensatory changes, posture change, things like that. And so it's quite scary that now that it's been identified and she's started doing physio and she's on pain meds and I'm doing exercises at home, the difference in her, I'm like, oh my God. It's yeah.
Yeah. I mean, we didn't even really touch on that, the whole interesting combination of behavior and pain,
Mhm.
and realizing that so many of these dogs, I mean, as a veterinarian, a general practitioner who's just in general practice, when I would see an aggressive dog behavior case, I couldn't wait to get them to the behaviorist.
Yeah.
You know, and sometimes you can't even do a thorough palpation physical exam
Yeah.
on these patients. And then to know that possibly this is all pain related, or a portion of it is pain
Yeah.
related, or the inciting cause was a painful condition that now has ramped up to some really horrible aggression. And that
Yeah.
happens all the time.
Mm.
I work with a company that is using thermal imaging.
Okay.
So a thermal imaging camera to be
Yeah.
able to try to identify asymmetry. So one of these sides is hotter than the other or colder than the other. It's not very specific, but very sensitive,
Yeah.
meaning that, just like they use thermal imaging to decide if your roof is leaking, we
Mhm.
don't know what caused the roof to leak, but we know it's leaking right here.
Yeah, yeah, yeah.
With 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 thermal imaging, it's really been wonderful for behaviorists because they can't palpate, and
But
they're
oh,
able to say, "Oh, there's something wrong," and then the animal gets an MRI and they find out it has horrible disc disease,
yeah.
and that's and neuropathic pain, so nerve pain, really interesting.
Wow, yeah, really interesting.
Yeah.
Um, we've had a question here about using the checklist that you're recommending. Christine has a dog that's 3, 10, and 16. Would you recommend using the same checklist for all ages, or is there different ones that you would use?
Well, there is a quality of life one when we're talking about end of life that for the really senior ones that I like very much. So
Yeah.
not just talking about basic pain management. So we we like that one if we're starting to talk about how what can I do, or how should I change, or things like that. So
Mhm.
it's a health related quality of life assessment. So it looks into pain, but also looks at the overall picture of animal happiness,
Yeah,
if
yeah,
to put it simply. And
yeah.
that came out of Glasgow, and that's not a bad one at all as well. But I think basic using the same one,
Yeah,
yeah, is what we do. We try to keep it pretty standard and easy for people because you can get the same idea.
yeah, definitely. We've got one here. I'm just wrapping up a research paper on communication between vet and dog owner on pain in OA dogs. It is such an important topic. When we communicate with one another better, the dog wins.
I can't wait to read that paper.
Yeah, that sounds really good.
Communication's the key. I think
Yeah.
that I think I implore people that if you are going to a veterinarian that doesn't communicate with you and you're not part of a team,
Mm.
the team approach to medicine is the way to go. Find another one.
Yeah. Yeah.
Find another veterinarian. And I think that education of pet owners is the key. So a lot of you who are coming to these CAM lives are really proactive, and you probably are doing something with dogs beyond the typical pet owner. So you're already there.
Yeah.
Evie, you probably feel like you're preaching to the choir, but you have the opportunity to share this knowledge with other pet owners
Yeah.
in the dog park, or in when you're some of you may be dog trainers, or or dog sporting, you're doing agility or things like that. So you have communication with other pet owners
Yeah.
where you can have the conversation, and I think that's really helpful.
I mean, my granny is like probably one of the biggest followers of CAM now that I'm part of it, and
Mhm.
she doesn't work with dogs at all. She just goes around to all her mates' house and tells them that their dogs have got OA. Sorting things out. Da, 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 da. Got a couple of questions just coming in. Having a reactive 3-year-old, she's had hydrotherapy for a while for fitness, also worked with the behaviourist, vet checks, etc., and nothing was picked up. I then started seeing a slight weirdness in the way she moved, which then began to turn into more obvious limp. Got her booked in for CT, and she has a luxating patella in both knees, currently recovering from second surgery. She hid the pain so well, and I now wonder if that's why she's reactive, undiagnosed pain.
Yeah. That's that's such a typical story that we see all the time. Like I said, I work with a veterinary behaviorist in New Jersey. I'm in Arizona, but we talk on the phone all the time. She'll send me cases, and she's the one that's using thermal imaging because she can't touch these animals. So she does an exam. She collects a lot of history, and so many times she sends them back to the referring vet and she's like, you need to do imaging. This dog's in pain, or we need to
Yeah.
do a pain trial. So she'll put them on an NSAID and maybe pregabalin or gabapentin or something else and do a trial. And so many times the behavior issue lessens, you know, the reactivity, so um, we, and unfortunately, I think a lot of veterinarians discount it too. Oh, the dog was born with luxating patellas, like like, oh, he's lived with it forever. Well, if you're running around and your kneecap pops in and out, it annoys the crap out of you.
Yeah,
Right.
no, definitely.
So I think that for me, another take home is everything is painful until otherwise.
That's
Every possibility, there could be a painful condition.
yeah,
We're talking about osteoarthritis, but think about the dogs that have chronic abdominal pain issues, like dogs that have chronic um, inflammatory bowel disease or pancreatitis or something like that. These
yeah,
dogs are not happy dogs. They need to have management of their disease to reduce pain. Think
yeah,
about somebody that has inflammatory bowel issues.
yeah,
They can't even go to work many days,
yeah,
right? They're really grumpy.
yeah, yeah, exactly, exactly. It's not nice, not nice at all.
Mm.
Um, what should I ask a potential new vet to ensure they're current with pain management?
I would say ask them if they've ever heard no. Have you heard of CAM if you're in the UK, have you heard of CAM?
Yeah,
Are you a member of the IVAPM? It's an international committee. How do you feel about are you doing advanced pain management techniques? Like do you stem cells or joint injections or do you use laser therapy for pain? Do you send they may not do rehabilitation, but do you refer to a rehab specialist? Like,
yeah,
so I ask all those questions. Um, I think that most of the time, if they, what type of, here's a good one that is acute pain, because you can tell a lot from a veterinarian if you ask them, what type of pain management do you do for routine his ovarian hysterectomy?
yeah, yeah.
Um, if they say, "Oh, they don't need any pain medicine," or whatever,
I need to keep them in
then you're like, "Next."
pain.
When you cut open my abdomen, I need pain medicine, right?
Just a little bit.
I that's helpful, and I know, some of you might say, "Wow, I feel really I feel like that's really aggressive," but I feel like for my own health, I treat my animals the same way as I treat my own
Yeah.
health. I interview the doctor that's gonna take care of me. Like, I I literally sit down. It's not just because I'm a doctor as well. I wanna I wanna make sure we're on the same path,
Mhm.
and there's no reason you don't have to make them feel like that you're searching everything up on Google.
Mhm.
You can be educated and you can say, I've read,
Mhm.
seen this, I know a lot. And that's, you'll find the right veterinarian that way.
Definitely. A question from Claire. So what would you recommend as an ideal length of time for a pain trial?
I usually say 2 weeks if you can, 2 weeks straight, and that always works out well. A week would probably be fine, but I tend to say 2 weeks because that's usually the time that I'm ready to see people are comfortable with having a revisit with me in 2 weeks. 1 week seems too soon for
Yeah,
people to
yeah,
come back in the
yeah.
office. And I think a month is too long because many times if we see and we usually do, to be honest with
Yeah,
everybody, I usually see with osteoarthritis, I usually see a positive response with a dog who hasn't been on anything. I
yeah.
usually see a positive response to a non-steroidal anti-inflammatory, to a doggy carprofen or meloxicam or one of those. I
Mhm.
usually see a positive response very quickly.
Yeah,
And so many times the pet owner sees it too. And if I make them wait a month, sometimes they don't give the meds the whole month. so
right.
so I like 2 weeks. I know I'm like, if you come back and there's a pill in this bottle, I will be very angry. And actually, so these new injections for osteoarthritis that
Mhm.
are really
Mm.
specific to nerve growth factor.
Yeah,
So they are monoclonal antibodies that are very specific to one particular pain pathway. People are saying, "Oh, this will be great as a last line defense." No, no, no. We're going to give that injection on day 1, and that's going to be wonderful
yeah,
because we're going to see you back in 3 to 4 weeks, give
yeah.
you a second one, and we're going to be able to do pain trial a lot better because
Yeah,
we control we control giving the medicine
yeah,
and
yeah,
it's there.
yeah,
So um and also you're going to see that so we have in the US we have the cat one. Do you have the cat one or the dog one?
yes, we do. We have both.
Right.
Yeah,
So we don't have the dog one yet in the
yeah,
US, but if people use it as their first line,
yeah,
boy, we're getting a lot. Like, this is an educational tool.
yeah.
Clients are amazed because they come back in a month and they're like, "Oh my gosh, they're so much better." And then we do it again, and then we are really happy with it
Mm,
if we're seeing them
yeah,
for the first time and being really proactive at the beginning.
yeah, yeah. No, definitely. We'll go for our last question. So it's from Catherine. She said, "What would your top tips be on explaining to an owner that you think the dog could be in pain? I seem to get a lot of the dog is just old, or oh, she's running and fine now." And Catherine is a dog trainer slash walker.
Yeah, that just old is I just use the humanization of it. I I'm 58 years old, so if somebody told me that I was just old, you're slowing down because you're just old, I would be really like, "What?" So I talk about that a lot, that um that what I'm saying about pain is I have used my expertise to either do a physical examination or I've watched your dog move. I am trained to look at changes in posture. And then when I palpate, your dog turns around and tries to bite me, which isn't just because he's old. So these are all the things. Or I've used a thermal camera and you see these discrepancies, all of these things put together. And that that's I say, well, if somebody told me that I was just old when I'm feeling pain, that wouldn't be legitimate. So I think that that's the biggest tip that I use for pet owners is humanizing it, saying, how do you feel today?
Yeah,
How does your knee feel? Did you walk up to did I can gather all my adrenaline and chase after that squirrel if I need to, but But when I'm done, my knee is throbbing
Yeah.
because,
Yeah.
but while I was doing it, nobody knew. I wasn't limping.
No.
I have that. So I have that type of conversation. I know it takes a long time,
Yeah.
but it's a aha moment for a lot of
Mm.
people. And in veterinary medicine, we tend to clients, they appreciate. I always felt like that this is the best profession in the world. I've never wanted to be anything else. Evie too, probably,
Yeah.
but the idea that people really want you to level with them. They want you, and they wanna have a collaborative relationship. It we don't wanna have a, "This is what you're doing."
Yeah.
And so I think that that's been the joy for me, that if I take a little bit of more time and have a conversation, all of a sudden it's an aha moment,
Yeah.
and it's become a trickle down to the whole pet owning community, um, because of this, and things like that, like online, all of these things. Why wouldn't somebody say, look at these things and say, you know what, maybe my dog isn't just old.
Yeah. Yeah. Definitely. And there are some great checklists out there, and pictures of different symptoms that you may not think about, to help prove that as well. And visualizing it helps.
I just looked because I saw somebody, will Librela ever be approved in the US? I heard by the end of 2013, by the end, I mean 2023, by the end of this year.
You've
It's
gone
been
back in
so
time.
long. That was the rumor that I heard from the Zoetis folks, that by the
Wow,
end of the year.
that's exciting for you guys.
Yeah, well, I know how wonderful it's been, and I encourage anybody who has a dog or cat. I think that what they found, and I think that all of the use um, in the rest of the world has said that, be, be patient. This is only one pathway, but the idea, make sure that you set yourself up for two injections for sure before you decide whether it's helping or not, and and realize that it's combined with everything. We always talk about multimodal, and this is the same with humans. When we're having a particularly hard day, we rotate, we do multiple things, for pain management,
Yeah,
and this is what we want to do with our pets too, and we want to combine non-pharma and pharma. My special interest is using things like laser therapy and acupuncture. It's wonderful because having the combination can be really helpful.
yeah, definitely. And I think you do see a lot of difference of pets that are just on a pain med for
Mhm.
it, or pets that are using a multimodal approach. Um, there's definitely a difference between those animals there. You can definitely see it.
Absolutely.
Perfect. Well, thank you very much for your time this evening, Jen. It's been so lovely talking to you.
It was great. Thank you, and thanks to everybody. You guys have wonderful questions, and you're doing wonderful stuff.
Definitely. We hope to have you back again soon.
Sure, anytime.
Perfect. So I hope you all enjoyed this evening. We'll be back again next week. We just had two this week because we've treated you. So yeah, we'll be back again next week with lots more information for you guys. Take care. Bye.